Welcome back to Module 2 of 1016 MSc, the Muscular System. This is Part B of Topic 2.3, Functional Muscle Groups of the Upper Limb. The learning outcomes for Topic 2.3b are to be able to identify muscles that move the forearm at the elbow and describe their actions, and to identify muscles that move the wrist and the digits and describe their actions. Now we start to move inferiorly down the arm to look at the muscles moving the forearm at the elbow. The anterior compartment of the upper limb contains the elbow flexors, and the posterior compartment of the upper limb contains the elbow extensors. There are three main elbow flexors found in the anterior compartment of the upper limb. The biceps brachii is the prime mover for elbow flexion. It is a two-headed fusiform muscle that extends from the coracoid process of the scapula and the glenoid cavity to insert by common tendon into the radial tuberosity. In addition to flexing the elbow, biceps brachii also supinates the forearm, lifting the radius. It is innervated by the musculocutaneous nerve. Brachialis is a strong muscle that lies deep to the biceps brachii, extending from the humerus to the ulna. It is a synergist to the biceps brachii in elbow flexion, lifting the ulna instead of the radius. Brachialis is also innervated by the musculocutaneous nerve. Brachioradialis is the third elbow flexor, contained in the anterior compartment of the upper arm. It is also a synergist to biceps brachii and brachialis, and works to its best advantage flexing the elbow when the forearm is partially pronated. However, brachioradialis is an interesting exception to the rule, as it is innervated by the radial nerve, which normally serves the muscles of the posterior compartment. Extensor muscles of the elbow lie in the posterior compartment of the upper arm. Triceps brachii is the prime mover of extension at the elbow. It is a large fleshy muscle and the only muscle of the posterior compartment of the upper arm. It has three heads originating from the glenoid cavity and the posterior humeral shaft, inserting by common tendon into the olecranon of the ulna. Triceps brachii is innervated by the radial nerve. Anterior is a short triangular muscle in the distal upper arm. It is a synergist of triceps brachii in elbow extension. Anterior is also innervated by the radial nerve. Similar to muscles found in the compartments of the upper arm, muscles in the anterior compartment of the lower arm are also flexors. These muscles flex the wrist and the digits. Consequently, muscles in the posterior compartment of the lower arm extend the wrist and the digits. There are several common pathologies that occur with overuse of the muscles of the forearm. Tennis elbow is the most common chronic musculoskeletal pain condition affecting the entire elbow. Tennis elbow results from the overuse of the muscles in the posterior compartment of the forearm, the extensor muscles. It is aggravated by gripping or repetitive activities of the forearm. Pain is located over the lateral humeral epicondyle and radiates distally into the forearm, hence the true anatomical name of the condition, lateral epicondylalgia. Golfer's elbow is considered to be the most common cause of medial elbow pain, although not nearly as common as its lateral counterpart. Golfer's elbow is also caused by chronic repetitive overuse of the forearm muscles, but in this case, it is overuse of the muscles in the anterior compartment of the forearm, the flexor muscle group. Pain is located over the medial epicondyle of the humerus, and is reproduced with resisted wrist flexion and forearm pronation. Consequently, the correct anatomical term for golfer's elbow is medial epicondylagea. The muscles of the anterior forearm that flex the wrist arise from a common flexor tendon attached to the medial epicondyle of the humerus. They insert on the metacarpals of the hand and are innervated by the median nerve. Most of the tendons of insertion are held in place at the wrist by a thickening of deep fascia called the flexor retinaculum. These include flexor carpi radialis, flexor carpi ulnaris, and palmaris longus, which inserts into the fascia of the palm. The muscles that flex the fingers also arise from the medial epicondyle and are innervated by the median nerve, but insert on the phalanges of the fingers. The finger flexors include flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus. Flexor digitorum profundus is partly innervated by the ulnar nerve, and flexor pollicis longus flexes the distal phalanx of the thumb. Although there are many names to learn, try and break the muscles down into compartments and then learn the action of the muscles located in that compartment to make it a little easier. Let's see if we can locate the muscles of the anterior forearm that flex the wrist and digits and pronate the forearm. The muscles of the anterior compartment that flex the wrist are flexor carpi radialis, which extends from the medial epicondyle of the humerus, runs diagonally across the forearm, and inserts into the lateral metacarpals via flexor retinaculum. Flexor carpi ulnaris is located more medially, has the same origin as flexor carpi radialis, but inserts via tendons into the medial metacarpals and carpals. Palmaris longus is located in between flexor carpi radialis and flexor carpi ulnaris, and inserts into the palmar aponeurosis, the deep fascia of the palm. Try palpating your own flexor tendons. Flex your wrist against some resistance. The tendon of palmaris longus is the most superficial in the center of your wrist. If you move laterally, you will feel the flexor carpi radialis tendon, and if you move more medially, the flexor carpi ulnaris tendon. Note the term pollicis relates to the thumb, and digitorum relates to the digits, or fingers. Deep to the wrist flexors are the muscles in the anterior compartment that flex the digits. Flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus, which flexes the thumb. The muscles of the posterior forearm that extend the wrist arise from a common extensor tendon attached to the lateral epicondyle of the humerus. They insert on the metacarpals of the hand and are innervated by the radial nerve. Most of the tendons of insertion are held in place at the posterior aspect of the hand by the extensor retinaculum to prevent bowstringing of the tendons when the wrist is hyperextended. These include extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris. The muscles that extend the fingers also arise from the lateral epicondyle and are innervated by the radial nerve, but insert on the phalanges of the fingers. The finger extensors include extensor digitorum, extensor indicis, and extensor digiti minimi. Abductor pollicis longus, extensor pollicis longus, and brevis all act to extend the distal phalanx of the thumb. As mentioned before, try and learn the muscles in compartments and then learn the action of the muscles located in that compartment to make it a little easier to remember. Now let's see if we can locate the muscles of the posterior forearm that extend the wrist and digits. The muscles of the posterior compartment that extend the wrist and the digits are extensor carpi radialis longus. It extends the wrist, originating on the lateral epicondyle of the humerus and inserting on the lateral metacarpals, often blending with brachioradialis. Extensor carpi radialis brevis also extends the wrist, but is shorter than and lies deep to extensor carpi radialis longus. Extensor carpi ulnaris also originates on the lateral epicondyle of the humerus and extends the wrist, but inserts on the medial metacarpals. Extensor digitorum is the prime mover of digit extension, originating on the lateral aspects of the humerus and inserting into the extensor expansion and distal phalanges of fingers 2 to 5. Extensor indicis is a small muscle arising from the distal ulna, inserting on the extensor expansion of the index finger. Extensor indicis extends the index finger, the pointer. And finally, as its name suggests, extensor digiti minimi extends the little finger. Try and answer these review questions now that you have completed Module 2, Topic 2.3, Part B, Muscles of the Upper Limb. Write your answers in your workbooks, and we will discuss these during your tutorial lesson. This is the end of this mini lecture. Please continue with Topic 2.4.